Hello, everyone.
Here we go.
Hello, sir.
Yes.
Sorry for the trouble, sir.
No, that's
Our
fine.
whole media was waiting over here for you.
That's fine. So I made
Yes.
an introduction about what is this and how does it work, but you can start making some questions and okay, let's do it.
Okay. So, sir, I would personally request you if you can give a quick overview again of this Iastm concept on physiotherapy, orthopedic physiotherapy, because we have some new participants, so they can get a quick
Yeah.
overview. And
Okay.
there are some participants who really want to know about you.
Yeah. This is a great project that I did in Brazil, and I developed this new concept in 2016. And the main idea is, first of all, we have guasha technique, which we scrape the skin, okay? And United States, they copied kind of this technique using stainless steel too. But compared to the bone, stainless steel is too dense. So if you press too hard, you can damage and it's painful. What I did, I'm using four tools. They're right here. I'm going to talk about that 2 minutes later. Uh, three things I developed on this concept. First of all, why this kind of material? The polyethylene is a super plastic, so it's light. It's like the car bumper, okay, on the front, on the back of the car. It's a super plastic and it's a little bit flexible, so it's more comfortable. And the density of this kind of material, it's almost exactly as the bone. For example, a bone has 1.2 grams of density. Polyethylene is 0.96, it's even less. But on the other hand, stainless steel is 8 grams per centimeters cubic. So it's much denser. So the reason why I use this kind of material, because when I touch, it's almost the same. If I close my eyes and touch with my finger and touch with the tool, it's about the same. The second thing is why the shape. For example, this tool, it's a copy of my forearm. The second tool, it's the copy of my elbow and the copy of my tip of the thumb. Okay? So it's, for example, so when I have to release something deep, I can use a thicker tool. And for example, this side of the tool is exactly the side of the hand. Well, my hand is pretty big, but it's the side of one hand. So if I want to get into a scapula or on the diaphragm.
Your camera is a little bit upwards. Can you set your camera? Because some students are saying your camera is a little bit upward, so they cannot see the tools quite comfortably.
Like
your
this?
Camera is a little upward. Put it no, a little downward. Can you pull it a little downward?
Better?
Yeah, now that's better. That's better.
Okay. So if I want to go to, for example, like here, on a diaphragm, I can get into the diaphragm like this, underneath, and release. If I want to get to a scapula, I can get underneath the scapula. So it's easier because the third part is why some tools, two of them, they're 8 millimeters. Because the side of the thumb has an area of contact of 8 millimeters. And 5 polishing. So the same here is happening.
Hello, sir.
Yeah, we are back. And then
Yep.
the other two tools in 5 millimeters. For example, this tool is very nice. I have here
Yep.
exactly as my thumb. You see? It's a copy. Or on the other side, the base of the thumb. So depending on how I need to touch my patient, I have all the curves here. The hypotenar area, for example, or the arch of the hand. And the second one, the last one, I have exactly the same shape. Smaller, medium, big. Even bigger. So I can use, for example, the side or the arch. So can you listen? Are you hearing me?
Your signals are quite
Okay.
interrupting,
Is it back?
and your voice is a little bit choppy.
It's
Yeah,
back.
a little
back
better,
now?
but your video is continuously being choppy and lagging.
Okay. So
it's back. It's back.
that's what I
Yeah, it's
call
back now.
a mechanical, physiological concept. Okay?
So, sir, some students are asking that these tools are only used for soft tissue mobilization, or we can use it for any other.
Yes. Every time you need to touch, to manipulate soft tissues, now we have tools that copy the hand. It's not to
Yes.
scrape. It's not like Graston. It's like manual therapy. This is the main difference. Scraping technique, gua sha, and Graston. And manual therapy by instrument, this kind of material. Can you listen? Can you hear me? Can you hear me? Can you hear me? Hello, Vishal.
Sorry, there was some kind of technical issues. Can you join again? Sorry, everyone. There was some technical issues, so. We are trying, ma'am. We will sort out the issues as soon as possible.
Here we go.
Yeah, sir.
Okay.
Sorry, sir. Some technical issues.
Connection. It's part of life nowadays.
Yes, sir.
So was it easy to understand what is this kind of concept that
Yes,
I'm
sir.
trying to develop? Okay. So
Yes,
to
sir.
conclude to everybody, you have two things in the world: scraping technique, Graston, and everything that use stainless steel. And this kind of clinical reasoning to use tools that has the same specification of the hand: density, shape, and thickness. Density, shape, and thickness.
That's great, sir.
Okay?
Yes, sir. So this was about Iastm and how can we use it on orthopedic surgery. And there was a question that Osley discussed about that: can we only use it on manual therapy, or that? Or told us on a brief review that how to use it as a tool for manual therapy, which resembles with our body structures like the hand, the thumb.
Yeah.
Any other if we want to? Sir is live right now. If
Yeah.
you have any questions about
density, shape, and thickness. For example, why 8 millimeters and why 5 millimeters? Because the side of the thumb has an area of contact of 8 millimeters. That was my study. And the tip of the finger has an area of contact of 5 millimeters. So that's why. So when if you want to buy a tool, ask yourself, what kind of curve? It has to have something related to your hand, so it's easier. So I can apply this on spas for neurological problem, sliding technique. I can use oscillating technique to release fascia. I can use scrape if I want polishing. I think you can see on the line. So you can use whenever you need to do whatever you have the demand, okay? Okay, I have a question here. Sharma, what shape is your technique we think about? Okay, we're back. You hear me?
Yeah, sir.
Okay, so sir, I just answer a question now.
So, sir, what kind of diseases or what kind of cases can after what kind of cases in orthopedic
you can
surgery
have
or orthopedic
muscle tension. What I recognize in the world is that people, physical therapy people, they're worried to treat the symptom. Forget that. You have to understand the dysfunction. If you have a gold medal athlete, okay, a runner, and he has a spas on the calf, you can do it. But on my calf, without pain, if I have spas, I can do it too. If you have a spas, neurological spas on a patient on the calf, you are going to do the same technique. So what we are trying to change around the world is don't think about the disease, think about the dysfunction. That's the signification of being a physical therapist. That's the main idea. So treat the dysfunction is one thing. Treat the symptom is another thing.
Come on, guys, come on. Bring up your questions.
Okay. Yeah, I'm going to leave here. I'm going to publish right here a WhatsApp. It's like +55. I just put it here. You can ask for videos, okay? It's in Portuguese, but I'm going to prepare it in English pretty soon and send again to you guys. But at least you can have some images which is pretty nice, and you can spread around your friends. I just put it there, and it's going to be a nice pleasure.
So everyone, Sir Gustavo has pasted his number, tested his number in the comment box. So anyone interested in the videos of Iastm and its concepts on different surgeries and different fields, so they can ask Dr. Gustavo personally about that.
Yeah, and who knows? I mean, if we can
the videos in Brazilian and Portuguese.
Yeah. Can you hear me now? Can you guys hear me? Okay, I think so. No voice. Okay. Okay. The only contraindication is if you have your skin damage. Okay, that's the only thing. If you have the skin damage, and the tools are made compared to the hand, an average of every hand. Okay, can you hear me? Can you hear me now? Okay. Yes. Okay. Yes. Okay.
Yes.
So very good. So that's the concept.
Sir, I can hear you.
Education, riding technique, fascia release, oscillating technique, and to release between two muscles. You can do that too.
A lot of technical issues on my side.
Okay. And another question: if you can use on ground re-education? Yes. Yeah, we have a technique called sliding with stretching. So you combine two techniques, okay? That's the main idea. You can combine. So everything you learn how to do with manual therapy, we can apply exactly the same with this kind of tools. That's the main idea, which is pretty easy. Why? Because our hand is going to last longer. That's the present and the beauty for this kind of soft tissue. Scraping, one technique. Grasp, American concept. This concept, Brazilian concept, we are trying to teach around the world. And next year, who knows if we can do the course in Pakistan, right? I'm my step here, so you can ask for the videos, and during the day I can answer one by one and send the videos. Okay. Yes, you can use on 74-year-old patient. Depend how is the skin. The skin is the problem.
No, sir.
Okay?
Some people...
No, I can hear you. I mean, your audio is down. The condition on every people, every person that has the skin, okay. Besides that, okay. I think his video is paused. Any age you can use. Okay, what age of the patient? People, just remember, if you can touch a patient on his skin, you can touch this tool. It's the same thing. Write that down. It's the same thing. The density is the same as my hand, as your hand. So whatever your hand can do, the tool gonna copy. It's a copy. That's the main thing. So indications, whatever your hand can.
About Iastm, and these were the tools which we can use on basically Iastm concept of Brazil को यूज़ कर सकते हैं. और काफ़ी स्टूडेंट्स के क्वेश्चन थे इस बात के ऊपर कि इनको हम कैसे ज्वाइन, यानी इसको हम टूल्स, इन टूल्स को कैसे ज्वाइन कर सकते हैं. सो हर किसी का एक अपना कॉन्सेप्ट होता है. सबको मेरी आवाज़ आ रही है? सबको मेरी आवाज़ आ रही है? Is it now clear? Sorry, due to some technical issues. इंडिकेशन इज़ बेसिकली यूज़ करने की टेक्निक्स जो हैं वो के काफ़ी सारी टेक्निक्स वगैरह अगर आप सीखना चाहते हैं तो डॉक्टर गुस्तावो का अपना पेज है, उनका इंस्टाग्राम पेज है, यूट्यूब पेज है, जिसके थ्रू आप सर्च कर सकते हैं टेक्निक्स को. अदर देन दैट उनका नंबर है जो उन्होंने चैट बॉक्स में दिया था. अगर उनसे किसी को कांटेक्ट करना है तो हम अपनी ग्रुप्स में भी है, उनका नंबर अपडेट कर देंगे और उनसे आप कांटेक्ट कर सकते हैं फॉर फर्दर. Okay, my voice is audible right now. तो उनसे आप कांटेक्ट कर सकते हैं फॉर फर्दर क्वायरीज एंड व्हाट. एंड अदर दैन दैट ये है कि इस कॉन्सेप्ट को आगे बढ़ाने के लिए ही हम लोग ये चीज़ यूज़ कर रहे हैं. एंड इवन सून वी आर थिंकिंग ऑफ अनदर प्रोजेक्ट विद डॉक्टर गुस्तावो एंड हिज ऑर्गेनाइजेशन इन पाकिस्तान. So thank you everyone for joining us on this informational webinar. And if someone is yet not clear about what this webinar was about, so this webinar was about how to use manual therapy through some tools. Okay, so these work. Thank you so much, Behzad bhai. Thank you so much. And once again, I would like to thank my team, my regional head Fatma, and other members, everyone. They worked very hard for this. So let's come to the certifications and all. You will be further guided in the groups about the certificates, and stay updated in the groups. And anything, if anyone has a query about this webinar, or if you want any other information or knowledge about this, so you can contact us anytime. And subscribe our YouTube page, follow our Facebook page, and follow our Instagram for further huge and informational and knowledgeable events. And we are going to arrange soon another event, so stay tuned. Thank you everyone. Thank you so much.